Now we'll discuss some of the documentation requirements that may impact reimbursement. As you know, detailed documentation is the foundation for the proper CPT code. The documentation must clearly support the medical necessity for the services provided. We've identified many times that the MUE and CCI edits result in upfront denials, and a lot of times those appeals require the inclusion of the final report to ensure the appeal be overturned. Unfortunately, many times that documentation isn't enough to overturn the original denial, and it leads to unsuccessful appeals and sometimes payment recoupment. So it's really important to review the documentation that you have on your final report. Make sure that everything is outlined, resulted, reported, everything's clear. You're very confident that that documentation will support not only the medical necessity, but the result of that procedure or specimen, stain, etc. Detailed documentation will become crucial in the upcoming months, especially if you're in the two MACs, Palmetto and WPS. They have recently finalized their new LCD regarding the documentation requirements for special stains and IHC stains. So I don't imagine that it's going to be too far in the distance here that they're going to be starting to request documentation to support those special stains, IHC stains, and they're going to be denying them up front. Providers in the Palmetto and WPS MACs are encouraging to review the new LCDs to ensure their clients are encouraged to review the new LCDs to ensure that your documentation will meet those required conditions. You want to do that before that takes effect. That way, if you do require submitting those final reports, you're pretty confident that they will meet the needs and they will be paid appropriately. Those LCDs do go into effect July 14th, 2024, and we've attached each LCD. You should be able to link right to it and review the clear documentation. It's pretty similar. They might have a couple different nuances between the two. But that being said, if these MACs are going to go and make these effective July 14th, I wouldn't be surprised if the other MACs follow suit, as well as some commercial payers. So if it's successful, be aware that there might be more coming, and commercial plans might be changing their requirements as well.
And just a quick note for anyone interested in following those links, they're not live on screen right now, but if you download the slide deck, they are live in the PDF.